a slide now. It'll give us, it'll let us know. Alrighty, and we're live. Hi everybody, welcome to the Betsy Freeman Booking Live show. Today we have stories from the field of healthcare, and I'm very excited to have three fabulous guests with us who are coming to us from literally all over the country today. I'm streaming from Vancouver, Washington, and I think I will pass over to Ahila first to tell us a little bit about herself, where she's coming to us from, and what she does. You're muted, ladies. I can't hear you. Yep, unmute, please. There we go.
Hi, can you hear me?
Yep.
Hi, everyone. I'm Ahila. I have a little bit about myself. I have my master's in nursing education. I worked as a nurse for at least 20 years. I graduated from my bachelor's in 2000. So it's 21 years nearly. I have all different experience, like some step down intensive care unit, case management, some med surge, some psychiatric experience, all those things. And my passion is teaching. So I am doing nursing education now. Out of the 20 years, I will say at least 10 years would be teaching in an academic setting, preparing different kind of nurses, LVN, RN, BSN. In India, I taught BSN. Here, I mostly taught LVN students. So that's a little bit about my background. And I'm primarily from California. Right now, I'm in Utah in a family trip. We are going to Zion National Park. That's about me. And I am traveling, so pardon me if you have interruption or anything like that.
Thank you so much for taking time out of your family vacation to be with us. I think that is so sweet, and I'm just thrilled to have you with us. All righty, Dr. Church, you're next.
Thank you, Betsy. I'm Dr. Emma Church. I'm a clinical psychologist here in Waco, Texas, in the heart of Texas. And I started my career in a college counseling center at Baylor University, doing psychotherapy there and training up doctoral students to be psychologists. And then about 5 years ago, I opened my own private practice in town. And I do a lot of work with PTSD and trauma, but I'm a generalist as well. So I see pretty much everything, but mostly working with adults, and a business owner on top of being a healthcare provider. So that's me.
Both of you are so impressive. And Chrissy has multi-careers going on as well. Tell us about yourself.
Well, yeah, I'm currently a nurse in the NICU. I've been doing that for about 8 years. And before that, I was a nurse in like with cardiac and neuro patients, adults. But I made the switch to NICU and never going back. And aside from that, I pursue creative stuff as well, acting and writing and basically everything, just whatever I feel like doing when I'm not nursing. And I live in Los Angeles. That's where I am now. I'm not on a trip. I wish I was, but.
It's a good life. And you have a comic strip, which I want to post the link to later. Post it later. And all of you, please feel free to post the links to your pages and all of those things if I forget to ask you for those later. So our first question for everyone, which I'll go back to you, Chrissy, first, if you don't mind, is what led you to choose your field and your specialty?
Since I was like a kid, the plan was to go to LA and do acting. So honestly, the way that I got in was not, it wasn't like, oh, it was my calling and I became a nurse. It was more that I was looking for a job to do that would support me while pursuing acting. And my mom's a nurse, and I always thought that it always sounded disgusting to me, but I had gone to college and I kept switching majors. I didn't know what I was doing. And then I came home to think about it. And in that time, my grandmother actually was in the ICU, and I went and visited her a lot. And I saw that everything was more contained than I thought it was going to be. She had all the tubes, all the things going on at the time, unfortunately, and she passed away. But I just thought that everything was, there wasn't like blood splattered on the wall or anything like that. It was not what I thought it was. And the nurses seemed to like really love, their work. So it changed my perspective on nursing. So switched my major, went to nursing, and the plan was always to go into NICU, but the wait when I graduated was really long, and I wanted to just start something. So I ended up starting with adults and cardiac. And then, years later, when I finally found an opportunity, I went into NICU, and now that's where I'll be forever. And I love it. It's very rewarding. It's not just a job. It turns out I really like it. So
that's an awesome story. I absolutely love it. Thank you. Ahila, what led you to your field?
All right, so will it be so cliche to say that I love helping people? That's why I became a nurse. That's kind of true. It's in me, I guess. I love helping when I could. And another thing is that my mom is not a nurse, but she wanted to be a nurse. So, and she is my role model. I always wanted to. If there is one person that I would like to please, would be my mom. I think I always wanted her approval, and I wanted to please her, and she's very invested, and she's a very good mom. I'm very blessed to have a very good mother who is very sacrificial. So she wanted me to be a nurse. And I guess when I finished my high school, I went into direct BSN. I didn't take the long route of going through one after another. I just finished my high school, went into bachelor's in nursing, and decided to go around and check all different countries, and came to US. I worked in Ireland for 1 year in a med-surg unit. So I really worked in 3 different continents as a nurse. So I worked in Ireland for a little bit, and I came to US, worked here ever since. We came here in 2006. Yeah. So it's been a while. I am working as a nurse here. And why I become a nurse educator, truly, it's just like, even if nobody pays me, I will still teach. I think that's how I am. I just love teaching. That's one thing I know how to do. I think that's one thing I can do well, if I have to say. And it's just my passion. I love teaching, and I only know nursing. So I'm a nurse educator. So I just love doing what I'm doing. Like I said, if someone pays me $10, I will teach for like $20. It's something I do, even if nothing else is given to me. But I'm really privileged that I can do that, what I can do, what I love to do, and someone is really paying a decent money for it. So I guess that's a combination. So career-wise, I'm in a good place. I love it. I love teaching. I love teaching nursing students. That's it.
That's beautiful. That's wonderful. And thank you for that story. And Dr. Church, I want to mention, and I actually went to undergrad together. So, but we both changed majors. I changed more than once as well. So go for it.
We'll have to catch up about that, because once your paths diverge from the conservatory, it's kind of people disappear into the big Bachelor of Arts school. But yeah, Betsy and I met at Wheaton College in Illinois. I was getting a vocal performance degree in the conservatory. But the summer between my junior and senior year of college, I had a traumatic near-death experience in surgery. Came back in my senior year, or in my junior year actually, and during the I struggled with mental health issues. And towards the end of that year, started seeking treatment. And after being a patient in therapy and experiencing just profound healing, and heard of mental health, just even the term mental health for the very first time as a patient and mental illness, I decided that that's something that I wanted to dedicate my life to providing for others. And so I changed my major then and finished after 6 years in undergrad. And went straight into a master's and doctoral program in clinical psychology. And my first job out of my doctorate was at Baylor's Counseling Center. And I was trained to be a generalist. I trained in a counseling center in upstate New York in my internship year. But when I came to Baylor, there was a lot of trauma that I ended up seeing with my patients. And so essentially, my patients have ended up teaching me and telling me what to specialize in. And so seeing a lot of rape survivors, and then a lot of developmental trauma and other sorts of trauma syndromes, that really has become a specialty to me. And in my private practice, that's what people seek me out for in general. So that would be the bulk of my patients, and therefore kind of my specialty at this point.
Oh, that's amazing. You all are doing such important work. And yeah, I actually tried out pre-nursing a while ago. I don't know if I really told any of you about that, but it was back in 2006. So I had been in LA for only about a couple of years. And, you know, I just started taking one class at a time. I took Psych 101, and then I took anatomy. And then I tried, while working full time, to take physiology and microbiology at the same time. And I think then I hit a wall with it, of just being like, you know what, nursing, I'm kind of like you, Chrissy. I'm a pretty squeamish person. So I was just like, you know, maybe I'm not doing this for the right reasons. So I went back to my mishmash of creative and communication sort of related things, which is a good life. But I really enjoy learning from all of you. So let's go on to the next question, which is the second question. It's a little easier to get it up on my phone. All right. How has your experience as a healthcare provider been impacted during COVID? I'm sure the next couple questions are sort of related to that. There's like sort of a subset. So we'll be probably talking about that for the next probably half hour. And then we have another question. We have another question in the middle of it. So, all right. So who wants to take this question first? Everybody like know right off the bat what they want to say? Ahila, go for it.
All right, I can go for it. So how did it impact? Actually, as an educator, I'm not in the front line. So in the beginning, when it all hit and it was like really scary, and all my friends are working with a patient every single day, and they come back to me with stories of how hard it is, and I see all these, you know, videos and things like that, I felt a little bit guilty, like, you know, having a license to work, but yet I am sitting, you know, behind the screen at home, very safe. That was a little bit, I felt a little guilty. But then after that, you know, I'm not covertly hiding. If there was a situation where I could help, I would definitely help. So, but then one thing that's made me, you know, I always felt like nursing is underrated, you know, because everything that we do, especially in America, like, you know, I worked in India, I worked in, like I said, in Ireland for a little bit, but I think here in America, especially, nurses do a lot of work, and they're very, very knowledgeable. All my students, even when I worked, I mean, when you do these exams and things like that, we are very knowledgeable and we do a lot of stuff. But however, it's very underrated in a clinical setting. So I think pandemic somehow gave nursing the right amount of respect that it deserves. You know, now people look at me in scrub, two kind of response I get. One, they're a little bit scared because, you know, maybe they think I worked with patients and I'm coming out, so they're a little bit scared. But second, I see that respect, you know, even though I'm not working with patients, but I'm seeing people are recognizing the hard work that is put in nursing, and how essential that this field is. And, you know, I think nursing, I don't know about other medical fields, I know it's a common theme, but yet at least for nursing, I would say that it's getting at least the right amount of focus, right amount of respect that it deserves. That's what I think that's what happened to nursing, at least because of pandemic. At least people look at nurses and they respect, they see the hard work that is involved, and I'm very happy about it.
That is a great change. Yeah, I hope so. Chrissy, you want to speak to that a little bit?
Yeah, this question is so, like, I could go on about this for hours. So I've been trying to think of how I will condense. I feel like I'll just have to like pick a topic or something, because I agree with Ahila about the guilt thing. I had some guilt too, because I work in NICU, and so I was not on like the front line either. Yes, I was in a hospital, and there's kind of a false sense of security in NICU all the time, not just during a pandemic, but I think it's just easy to like look at these fresh new babies and think like they don't have anything, they're fine. And I think there was a lot of guards being let down, sometimes because of that. And or maybe, in the beginning when PPE, which everyone knows what that is now, was not, available. NICU was not seen as like a priority, which was understandable. I mean, someone coming into the ER coughing in your face, those people should be protected. But, at the time we didn't know if babies could pass it along, if they were getting it in utero, all this stuff. So, and it was so long, like there's so many stages, I feel like, of the pandemic. I mean, almost every day was like a stage. Everything was changing every day. The guidance from the CDC, every single time I came to work, there was new rules, new protocols. At that very first, you weren't allowed to wear a mask. People were getting in trouble for wearing masks. And then like literally like 2 days later, it was like, oh, never mind, bring a mask. We can't give you any, but find anything you can find, bring it and wear it. So just a lot of ups and downs. And I also decreased my hours during the pandemic. I mean, I had been, excuse me, I had been wanting to decrease my hours anyway, to pursue kind of more of my acting and writing and stuff. But, an opportunity came along during the pandemic, and I did feel kind of guilty for taking it, like as if, like, oh, the world's in a crisis, I'm just going to step back and do less. But at the same time, like selfishly, I feel like I wanted to also protect myself, and be exposed as minimally as possible. I mean, nowadays we have the gear we need and I feel much safer. So I don't worry about that. I've taken care of babies that were on isolation from COVID positive moms, and we have what we need. So, well, almost. I also believe, I don't know what Ahila thinks or anything. I mean, I believe that COVID is an airborne virus, and we're not really treating it as such. And I think it's because we don't have the resources to do that. So they're calling it a droplet. The difference is just that airborne is like contracted like more easily. It passes in much tinier droplets, just being in a room with someone who is breathing, you can catch it. It doesn't have to be a cough or a sneeze or whatever. So I have a feeling that it's airborne, but they can't officially call it that because we don't have the resources for that. An airborne patient would go into a negative pressure room. We don't have that many negative pressure rooms to accommodate every COVID patient, and the staff and the equipment, we just don't have that. So I think there's a lot. I just feel like 10 years from now, we'll look back and hopefully have made adjustments and learned a lot of things. That's what I hope. It's just a big learning experience, and it's a pain to be kind of the guinea pig of that for the 21st century, but here we are.
Yes. Well, thank you for being a part of the nursing community, and all of you to being a part of the healthcare community during this crisis as we all try to figure it out. I know you've all taken a lot of hits in various ways and made a lot of sacrifices that we don't even know about. Dr. Church, how has your experience as a healthcare provider been impacted by the pandemic?
I would say that for mental health in our country, the pandemic has been very illuminating for so many people. I think we've seen a lot in terms of the suicide rates and just awareness of suicidality and its prevalence in our culture, which it was prevalent prior to the pandemic, but you have something that comes in and kind of cuts across all social classes and all groups as what I find to be a collective traumatic experience of we are all out of control. No one has control over their lives anymore. Did we ever have control? That's debatable. I tend to think not so much, but it's just this awareness that has come to where, I had things planned. I had a wedding planned. Those sorts of things, and just to have the rug pulled out from underneath people. And so we've seen a lot of responses where people are feeling hopeless they may have been patients prior to the pandemic and treating depression, but now they have anxiety as well. And so the intensity and acuity of patient care has increased in my experience. I had not had the opportunity to quarantine really during the pandemic. And so, watching other people and other professionals take time at home and kind of getting in new rhythms with their family and valuing just a day in, day out experience. I think that I have worked more the past year than I have ever in my career. And part of that is my own kind of felt need for services during this time. I'm constantly running at a wait list. So taking on extra patients after hours. I'm a single mom. And so the weeks when I don't have custody of my children, seeing patients later into the evening, sometimes on weekends, just to accommodate the number of people needing services. And so I think, it is both tragic and also important that our country has realized the need for mental health care. Insurance companies have almost across the board covered telehealth as an option for mental health care, even insurance companies that don't cover mental health services. So if you were to go in person to a therapist, you would have no coverage, but if you're doing telehealth, they're covering it. And so I think those are some good changes. But for me personally, as a healthcare provider, it has been a time of increased work and increased stress. And sometimes I forget to think that I myself am a person who is also in a pandemic and also impacted by it, because I'm constantly thinking about the treatment of my patients and how it's affecting them and the community around me.
Yeah, that's really, you covered a lot there. All of you did. Thank you. The mental health challenges have been they've been more acute for me in the last year or two in ways that I didn't expect. In some ways, having a global crisis helped me through my personal crises in a way where I felt like, well, I'm not alone in this. So, there were more people to talk to than ever before. My own anxiety was sort of similar to what it has always been, of feeling like I cannot be there for everybody at once. And then failing to show up for to take the time that I need for myself at times, or et cetera. And so I really, I hope that all of you, and anybody watching, I do, by the way, would love to hear what you all would like to know. If I can bring in some questions from anybody watching, feel free to post. All right, we'll go on to the next question. What are some positive changes you've seen in your field brought on because of the pandemic? Chris, do you want to take that one first?
Sure. One thing that I noticed, like at work, is kind of more of the camaraderie or whatever. Like, I feel like, especially in NICU, we're very, we're pretty closed off from the rest of the hospital. We're extremely specialty unit, so we don't really see, or interact with other people. And I just feel like there was more of this spirit, like going into work in the dark in the morning, like walking in with all the nurses that work in all the different units and all the healthcare workers, everybody, more of just a feeling of like, we can do this. Like, I just felt like we were a little bit more interconnected, even though we didn't really know each other. And also, like, amongst our units, like I work in NICU, but then between like labor and delivery and postpartum as well, like I just felt like there was a little bit more like teamwork and understanding. And I just hope that, like I said, again, like back to like the learning experience, I hope that we know how to deal with this in the future. And, we've learned and we're taking notes. Not that there's going to be another pandemic, knock on wood, but, just even just disasters, in general, like how to handle the big influx of patients and that kind of thing. Yeah.
Thank you. Yeah, that's good to hear, Dr. Church.
I think some of the things that I stated earlier can apply to this question with increased insurance coverage for some mental health services because of an increased awareness of the need for mental health services. So, you know, at simultaneously both sad and also positive. And having been a psychologist for 11 years now, knowing that these issues, suicidality, PTSD, anxiety disorders have been happening for forever, but now there is more awareness and therefore more utilization of services is really encouraging. What Chrissy said about this kind of we're in this together type feel to the community, you know, I think about community wellness and mental health when I think about my individual patients. And I've had a lot of patients bringing in stories about kind of silver linings that have happened because of or that have been highlighted because of the pandemic, of, you know, things that they're grateful for, or a coming together of a family unit or a community to help people in need, depending on how COVID is affecting someone in their midst. And so I think those are some of the really wonderful and inspiring components of going through something collectively together where everyone is impacted. It is not selective and it doesn't discriminate. And so we've all become vulnerable. And within that vulnerability, there has been, I think, a reaching across of people groups and communities to support each other and show greater compassion. So.
Good, thank you. Ahila, how have you seen positive changes come about from the pandemic?
I mean, I'm thinking about nursing education. Definitely, there are more people open to becoming nurses for the right reason now. I think, you know, it's well paid, and nursing is well paid, and rightfully so, because it involves stress. With or without pandemic, it involves stress. If you are there in the floor 12 hours, then you are doing something, you are working hard. There are people always not taking breaks and doing always work. That's how nursing shift works, no matter where you're working. So I think right now I'm seeing more and more people are coming. So because they saw what is a need, right? They saw how important it is. And also for job, there is very high job security now. At least we all always know that medical care is important, but now we know it's like practically, we know it's like very tangible now. That, you know, you can shut down everything else, but not a hospital. You can never shut down a hospital, right? It has to remain open no matter what. So I think that's what is happening more. And I see more and more students coming in. All these new people coming in come with the right perspective. I'm seeing that more and more. I have seen always in every class there is at least one or two people who are there for the right reason. But now I see more and more of that. They are coming for the right reason. They know exactly what they are signing up for. They're ready to tackle things, so on and so forth. So I think that is a positive thing that's happening. I don't know how long it will stay, but I'm seeing that now.
Yes. Well, that's, I think, so much of it, like Chrissy was saying, is just there's so much that's new in the next, you know, that we're going to be learning and looking back on. Some of this stuff will fade away and we won't remember it as well. And some of it will be, you know, our whole world will be impacted from it. And it's almost, you know, like it's going into a war situation almost, where there are certain things, you know, I was in college, you know, when 9/11 happened and our world was never the same. Airport security was never the same. Many other things are never the same after that. And now we just take certain things for granted, certain precautions, you know, that we didn't like and people grumbled about it, but then we just realized this was a new world and we had to protect ourselves in different ways. And so now we're finding that we have to protect ourselves and each other in different ways in the face of this virus, you know, and it extends, it's emotional, it's physical, it's spiritual. I mean, there's no way in which we haven't been affected. My best friend directs a medical clinic in Iowa and she's watching, she has a question. So I'm going to read it to you all. And anyone who wants to answer it, raise your hand. And I'm going to read it out loud because I can't remember it. Here we go. I would be interested to know how other members of the healthcare community and teams like doctors can help support each of you in taking the best care of your patients or learners. Does that make sense? How could others, and how could doctors and other members of your team best support you? That's what she's asking. I had to read it out loud, change the pronouns, and then think about it. So thank you, Smarty Pants, Dr. Megan. All right, Chrissy, go.
Okay, so the question's coming from a doctor, is that right?
Yes. Mm-hmm.
I mean, I don't know like what her specialty is, you know, and I tend to only like work with neonatologists. So again, I'm in my own little corner, but I just know that like patience and good communication just goes such a long way in healthcare. You know, just staying calm, you know, not, you know, sometimes nurses, doctors, everyone, they can get frustrated on the job and take it out on the pharmacist on the phone, you know, and that kind of thing. There's, you know, this high stress, like Ahila was saying, you're constantly moving, you need this thing right now. And if we can all just take a deep breath, have a little patience with each other, and, you know, kinder communication, I think would just smooth this, you know, every day, pandemic or not, but, you know.
How do you think, is your communication with people mostly face-to-face? Is it mostly phone calls, or is it mostly like written notes in the machine?
At my job, we're very close with the neonatologists, you know, because that's kind of the way our unit is. So we see them a lot face to face. But, you know, as far as like talking to pharmacy or you know, ultrasound or, you know, those departments, that's usually on the phone. Yeah.
And now, are you all wearing masks you're wearing masks much more of the time than you were before?
Yeah, I mean, constantly with the mask, and then face shield with like direct patient care. Yeah.
Does that make communication harder?
Yeah, but it's not too bad, you know, and I can't speak for all the units, but we're such a like an intimate unit. Like, I just feel like we're kind of, whenever we're talking in person, we're pretty close to each other, and it doesn't really make it too hard. I mean, it's a shame that people can't see you smiling. Like you have to do maybe a little bit more work to let them know that you're smiling. But yeah, otherwise it hasn't impacted me too much.
That's good. All right. Who's ready? Who wants to answer next?
I think,
Go for it, Emma, and then we'll come to Ahila next.
In terms of kind of doctors being medical doctors, physicians, collaborating and supporting myself as a psychologist, but other mental health providers, I think that is the biggest thing, is really respecting and valuing each part of healthcare, in the holistic healthcare of a patient. So not only their physical body, but also their mind and their soul. And so as somebody who cares for the mind and the soul, having an understanding that what is provided there is valuable, and also that there's something that potentially can be learned by tapping into somebody's therapist. If you're a physician treating a patient, kind of taking time out to consult or provide feedback there. I know for clinical psychology, I often have thoughts on psychopharmacology for some of my patients and different medications that just in my experience of watching patients on them might be better or worse. And so opening those channels to respect the voices of all of the team that might support each patient, that helps support me as a professional. And I have worked with wonderful physicians in the community and great psychiatrists, and that hasn't been a problem for me specifically in private practice, but historically and in other settings, there has been a divide between physicians and mental health practitioners. And I've seen that also within the medical community between the doctors, who kind of at times seem like the celebrity of the show in healthcare, and the others are the supporting cast members. But every piece is equally valuable, and a doctor without adequate nurses is not going to perform. And so just valuing each part and each professional equally goes a long way. I had to be tested for COVID because I had an exposure, and I was visiting my parents up in Cleveland, and I was doing a telehealth check-in to get an appointment to get tested. and was surprised when the doctor, after asking what I did, said, "Thank you so much for what you've done and the work that you've done during the pandemic," because that's not something that I hear typically. So it was a surprise to me. I'm like, oh yes, I am also a healthcare provider. So just those words were really supportive and kind of allow me to reflect on the work that I've been doing myself as somebody who's on the front lines.
That's really great. Yeah, those words of affirmation are really important. I think there's not a single person that doesn't get something out of that when somebody just recognizes something that you might do routinely, but it doesn't mean that it isn't exhausting and it doesn't, bring some health back into your heart to hear those words. So thank you for reminding us about that. Ahila?
Most of the point, what I wanted to discuss was whatever Dr. Emma discussed. Yeah, exactly the same thing. In medical field, nothing is a solo performance. No, it's not only between medical provider and nurses and pharmacist and mental health provider. Not only that, between two nurses and between one nurse and another nurse, there has to be lots of communication, lots of working together, lots of being very humble to hear other people's opinion and what they have to say. And I think that is the only way to do it. There is just no other way to tackle it. To do an efficient job, it is a teamwork. And when we say it, it is really a teamwork. When you're working in a floor, you're not doing anything by yourself. And if we are doing that, then we are not doing it right. So I think we all have to work together. That's the only thing. I know it's such a common expression, but it is very important in situations like this for the best care that we can give our patient. We all have to work together, communicate, like Chrissy said, and definitely be open to what the other person, and not only between medical providers, but even with family. Sometimes I see the patient family knows much more than what they are saying. And sometimes parents, especially when we are working with kids, parents know much more about it, much more than a doctor could ever know, things like that. So I guess those are simple things that we have to pay attention to. Nothing a big strategy. As long as we all learn to work together would be good.
That's good. Yeah, it's interesting. I mean, it must be, I'm used to working in some kind of a performance, music performance environment, and it feels very high pressure, but then you could always remind yourself that there's no one's health or life really at stake when you're on stage. Unless a performer has a, sudden, incidents or something happening, you're usually, you work really hard to make it a safe environment, and then you don't think about that. But, the teamwork aspect is even more important because you're affecting, I've heard nurses talk about, every day, you're human, people make mistakes every single day, and in order to help your brain function well at optimum, you need to feel encouraged and uplifted, right? You need to feel that the team that you're working with is on your side. And I would imagine that contributes to everybody's health in the room, and, not just the patient. Does anyone have any further thoughts they want to offer on that question? Thank you. Thank you, Dr. Romine, for that question. We can go on to the next one as well, which I can pull back up on my handy-dandy Gmail list. Alrighty, we said positive changes, and then, okay, so what are your thoughts about the healthcare needs? Dr. Church wrote this one, I love this. What are your thoughts about the healthcare needs of the populace moving forward in a post-COVID society? Let's imagine that there will be a day when we don't think of COVID as being a pressing problem. Who would like to take that one first?
I'm happy to maybe brain dump a little bit. I asked the question and hadn't really thought to answer it in my head when I asked it. I just knew it was important. So, moving forward, some of these changes that we've talked about, just becoming really ingrained, the teamwork aspect, the awareness that, everybody is going through something, and we don't know quite what that might look like behind closed doors, but when we're interacting with people in different settings, at restaurants, in retail, in the doctor's office, to know that we're all humans on this planet dealing with our own stressors and struggles, and they may be pandemic related or not, but that we're all human here. And so I hope that there is just a greater compassion in the world and within healthcare post-pandemic. And I think of it being a post-pandemic world now in some ways, with the vaccine being readily available and people more and more are being vaccinated, and kind of, in Texas, there have been releases for the mandate for wearing masks. Different businesses are handling that differently, but we're starting to see things open up again. And so my hope is that we take a moment to pause and realize what it is that we have been through. When I think about the treatment of trauma in any specific unique patient, one of the most important things is the opportunity to integrate their experience. And, in our society, there's this pressure to keep going and move forward. And what's your 5-year plan? And what are you doing next week? And, and we never stop. And summer breaks are filled with this camp and here to here to here. And so I think people got a little bit of a taste of a slowed down life that I really hope we are able to hold on to and take a moment, and whether that's in your relationships, to talk about how things have been and what you've been through over the last year, or whether that's with a therapist or a close friend, to really kind of process how this has impacted you, the good, the bad, and the ugly, and maybe reevaluate your values moving forward, how you want to spend your time. Do you want to be working 40 to 70-hour work weeks? Do you want to be spending time with friends that aren't kind to you? Do you want to, time is so precious and our lives are so precious. And so I really hope that there is this awareness and opportunity to pause and kind of take inventory of what's really important, and hopefully see that change people's mental health as they move forward with a slower pace of life, less of a rat race. So in terms of that, I think ongoing mental health care, that's always going to be a fact of life. People will need mental health care, but just what we can do for each other's mental health, even outside of a healthcare setting, to encourage each other to savor life a little bit more.
That's so important. Yeah, we have been forced to say, okay, if I could only spend time with a couple of people this week outside of my family, who would they be? And then, your real priorities come forward. It's a real interesting test. And yeah, I think that is really important, because we do put ourselves through some crap that we really probably shouldn't. Chrissy, what do you think about the post-COVID world?
Yeah, I agree with the whole, I hope that this has changed the perspective of, I don't know how it can't change people's perspective of moving forward, as far as, like you said, who you have in your life and kind of just what's really important. I know the pandemic did that for me, and I'm, weirdly kind of grateful for it. It was terrible timing, and, of course I hated it and stuff, but at the same time, if it didn't happen, I kind of wouldn't be the person I am today. My priorities are different now, very different. But when I read this question, my thoughts went to and I don't want to get political, and I don't know what everyone's beliefs are, but working in healthcare and just seeing the different populations and the struggles they face, it really makes me I'm on board with the idea of social medicine. And I know it's not perfect, and I know that the countries that do it, it's not perfect, and there are a lot of problems. And I think that those problems need to be addressed. And I think we need to not just ignore it, but fix it. Because I do feel like healthcare is one of those basic needs that everyone should get. I don't mean everyone should get it. I mean, entitled. I just mean that I think it's just one of those benefits that, especially in the United States, that we should be able to afford our people, so that people don't have to worry about that, because that is a very, very basic necessity. And, people don't want to pay for it, but we already pay for a lot of people. We pay for all the uninsured people who go to the hospital, all the homeless people, everybody who comes into the hospital's eating that. And then, you know, our tax dollars are going to that. So I feel like we could spend our money better and smarter, do more preventative, definitely do more mental health care. I wish that was more widespread and more accepted. And I think it's slowly getting there, but, you know, we have a long way to go. You know, mental health care is very accepted in Los Angeles. You know, everyone has a therapist and no one thinks twice about like mentioning it. But, you know, like in the Midwest and in the South and stuff, I think, you know, it's different. I'm from Florida. No one talks about their therapists. Maybe they are now, but when I was living there, they weren't. Yeah, I just think that access to good healthcare is important. And I think if we were able to fix that system and give everyone that chance, because I actually, the way I'm thankful for Obamacare, because before that, I wouldn't have been able to get healthcare if it wasn't from a group plan. I had one seizure in 2007. I started taking Keppra. And when I went to move to California to pursue acting and stuff, I looked into buying an individual health plan back then, pre-Obamacare, back in 2007, 2009. And I didn't qualify because I was taking Keppra. They were like, nope, you know, that's like a we don't want you if you're on that why are you on that medicine? So I would have had to work at a benefited job, and I wouldn't have had all the free time I have now to do the other stuff I want to do. So I just feel like healthcare is so limited and so hard. So that's my point. So yeah, I just think that the access should be increased for everybody. And I think we would solve a lot of access to healthcare, and mental health care for everyone would solve a lot of our problems, you know, far beyond healthcare in this country.
Yeah, you know, I mean, the healthcare question about, socialized healthcare is, you know, it has so many different facets to it, and we could spend many hours talking about it. And that's what I love about this show, is that it opens up many other possible shows. I mean, that's not really the one thing I love about it. I just love talking with you all and hearing what you have to say. Because honestly, scheduling is not my favorite part of the show. But I would say when like Emma had shared about earlier on her crisis, maybe I've had more than one, but spaced many years apart for the most part. And my first one was in spring of 2001. So I found myself, you know, I was an undergrad who had medical debt. So but I went back to school and I had to be paying off these loans. I mean, from the beginning of I guess adulthood, or, I'm an oldest child. I always want to be like super responsible, right? I always want my credit to be perfect, just like, my GPA, right? Impossible. It's been impossible for me. And I had to make a conscious choice a few years ago. And actually, maybe it wasn't a totally conscious choice, where I was working, I was at one point working for 4 different ministries 2 years ago, not getting paid by all of them, but doing music and administration. But I didn't have any healthcare that was paid for, because none of these ministries could afford, some of them couldn't afford to even pay me, much less, add on healthcare to their budget for, I wasn't a full-time employee of any of these places. And I found myself during a sermon, actually at the church that Ahila and I went to on Saturdays, suddenly writing down my budget. And it was almost like one of those things where, it just comes out of the air. You don't even know why you're doing it. And seeing that there were bills that I wasn't going to be able to pay, that I was going to have to stop paying the minimum payments on my credit cards. And kind of saying, like, to God in my head, no, this isn't where we're going. This is not okay with me. I'm not doing this again. I had worked on this, and I took a job, like Chrissy said, I had worked full time so that I could have health coverage in many environments, so that, because to guard against any kind of possible emergency that might happen. And I was never, and maybe that kept me out of having trouble, but it's always when I'm uninsured or underinsured that I have a crisis. So what that is about, or maybe when it's all said and done, like, you just can't make that the center of your life. You can't make your credit score the center of your life, but at the same time, there's a lot more that we could do to take care of ourselves and each other. I don't know, some things have got to change.
Yeah, I just think it's just like, it's just one of those basic life things that people shouldn't have to worry about. Not in our country. I mean, not in any country, hopefully, but definitely not in our country. And a visit to the hospital uninsured is a life ruiner. I mean, can be. So
yeah, and there's no shortage of people living in their cars, really, I think, because of a medical crisis, essentially, that they cannot get adequate care for, and they cannot get adequate housing for, and there's nobody to help them, especially through the mental health, because to be able to manage and balance your budget takes a really high level of mental health that, how can you maintain that if you don't even have stable housing?
Right.
And thinking about post-COVID, and if we want to be a country that is innovative, and that is a country of leaders, and as a country that, this American dream that isn't actually reality, but speaks to a level of happiness that we would like the people living in this country to live in fear, whether that's fear of a pandemic, which it has happened, or fear of a hospital visit that one can't pay for, or fear of not having insurance, or fear of having more debt than you're able to have income. That's limiting the potential for us to be the country that I think that we would want to be. And so I really am hoping, and I'm so grateful that Chrissy brought this up, that it's kind of a slap to the collective face of people in positions of power to make these sorts of decisions, to say, hey, this is an investment worth making. It's an investment in our people and in ourselves. So
it's tricky, because I don't want to take away giving people the choice, especially of who their therapist is or their surgeon is, if you are having whether it's a major surgery or an elective surgery. And so how we're going to make it work for people to get access to the best kind of care that they could possibly get without making it out of reach financially. I mean, I feel like we're probably never, there's never going to be like a perfect one size fits all solution. And that's why I think it's really hard to talk about well, but I think you guys I appreciate everything you've said so far. We lost Ahila, which I hope, was not too abrupt for her, and I'm sure everything's okay there. And I'm so glad that she was with us. We've got about 5 more minutes if you'd like to answer the last question that she wrote, which was about negative changes. I don't know if I want to end on that note, but why don't we, does anyone want to answer that question? If not, I'm fine with changing the subject for 5 more minutes.
I'm going to answer it in a less negative way, if that's helpful.
Yeah.
I think it's really important to be aware of the negative, which I think is burnout. I'm sitting here with Chrissy and Ahila, and I have a number of patients that are nurses, some nurses in the ER, and they are overworked and undervalued and incentivized for amounts of money that are pitiful, to work more, and the strain on them during this time. I've seen, and with teachers as well, I'll have to say, people leaving that work environment because what is asked is too much to ask of a person. And to reflect, I think, on my own profession, other therapists and myself, I know that we have been overworked. And so if we are overworking and taxing the people that are here to be helping us as a society, that's pretty bleak. So my hope would be that not only with positive affirmations, but just kind of a shift in understanding and valuing of healthcare providers, seeing us as people too, would be really wonderful and helpful. And to be honest, I'm gonna call myself out. It starts with me. I have this realization of, oh yes, I am a frontline worker. I have not, I did some telehealth to accommodate patients and to have precautions, but realizing that I am somebody that I have overworked myself. So starting at home, and maybe I know for me, approaching my own scheduling differently moving forward. I know that's going to be startling to some of my patients to not have as much access to me, but realizing that I too am somebody that needs support and healthcare. And I have a therapist. I've been in therapy for almost 20 years, who I adore, and a trauma therapist who's really helpful for me. But just helping the helpers is something that I think is really important. And I have seen some negative impact on us helpers during this time.
Yeah. Chrissy.
Yeah, I mean, that was one of the questions that I didn't really have an answer for. And yeah, I kind of thought, oh, I don't want to end it on that. But it just kind of going back to my whole, like, I just hope that we learn a lot from this, and that we, can do better in the future. Yeah.
Yeah, Chrissy and I were talking a little bit earlier on, but before we went live, about how hard it is for us to schedule rest and give ourselves a full weekend or a full day of rest. There's I was saying I have to schedule a time and actually get in my car and drive somewhere where very few people know where I am or where I'm going, and honestly, I've changed my phone number 3 or 4 times in the last 15 years. Sometimes in the midst of a crisis, and sometimes not. Sometimes I just know that it's going to give me more rest because I just have too much input and I can't process it all. And I've got to prioritize who I talk to and who I can support, and who are the people that I know that there's some reciprocity there's some real give and take, and that, so that I can be the best person. I don't know if I'll ever become the best person I could possibly be, but when you're functioning at high capacity and when you're not.
Yeah.
So thank you so much for being here, and thank you to Ahila, Dr. Church, and Chrissy. I hope you'll come on many more times, and we'll talk about all different things. Next week, we'll be talking about board games. We're going to do something that's not as serious for a change. And so my guests will be Lorraine Eskridge Williams, Marie Pettit, and Josh Chandra. So I hope you all tune in for that. Feel free to post your social media, your websites, your comic strip, Chrissy, and all of your fun things below, and upload, download wherever you like. Peace to everyone watching, and thank you for tuning in.
Thanks.
Thank you. Bye. Great talking to you guys.
Thank you.